So I first want to say what a big honor it is to be speaking here today, and thank you really to the Religion and Public Health Collaborative, to Ellen Eidler, and to John for inviting me. And also thank you to Susan Lanskroner for all that you've done to help host me. It's been really wonderful being back home here at Emory. And then I also, before I get started, want to acknowledge that this work, I've really shifted, as John says. I was trained here in religion and in the PCRL, course of study in the GDR. And so I've really shifted in my work. I work a lot in the social sciences, and so now everything that I do is collaborative, and this paper and this work is no exception. So along with the two co-PIs on the project from the Department of Sociology, this represents our collaborative work on Voices into Action that I'll be telling you about today, including Sarah Bowen, who's our project director, and Seneca Elliott. So this is really a collaborative project, and I've loved working on it in that way. I was really lucky enough to join this project that I'm going to tell you all about just as it was getting underway. We had just gotten the USDA funding at NC State, and I was finishing up my graduate work at Emory. I started as a part-time project manager on the project while I was finishing graduate school, and that has kind of parlayed into a faculty position, and I now serve as co-PI on the grant. So it's really been an incredible experience. The first thing that I want to do is introduce you to our project, which is called Voices into Action, the Family's Food and Health Project. And it's a USDA-funded study of the family food environment. Our project has both research and outreach components. So our goal is for these to be really intertwined. Our goal is for this to be a really community-based participatory research project. And much of my work on the project has really been on the outreach side, although I'm going to talk a lot about our research with the mothers who are part of the project as well. And our goal is to really follow this praxis framework where the research and analysis are informing the practice in the community, and it's kind of a cyclical formation. And this is a really big project. I'll give you an overview in just a second, and I'm only talking about a tiny fraction of what we've been able to do around food security, so I'm happy to answer any questions that you have after the presentation. So, feminist scholars have drawn important attention to the ways that inequalities based on racism, sexism, classism, and heterosexism impact hunger and food insecurity. And much of this work has focused on analyzing policies, norms, and public health frameworks that shape the food system. This paper and this work contributes to this vibrant and growing body of literature by reporting the findings from a large-scale research study of food practices and environments that really places the voices, contexts, and experiences of low-income women at the center of our analysis. Our goal with the project is to advance social justice, particularly related to the food environment. And as such, we've adopted participatory research methods that allowed us to partner with communities to address the issues that they found important. So Voices into Action follows 124 working class and poor families with young children. At the beginning of our project, the young children were between the ages of 2 and 18. And we're looking at that over a 5-year period. Our interdisciplinary team has conducted multiple semi-structured interviews, 24-hour food recalls, and ethnographic observations with these families in order to better understand the complex factors that influence families' beliefs, decisions, and practices related to food. We've also organized asset mapping workshops and spearheaded community food assessments in 3 counties. And based on the results of these activities, we have supported the development of community-based action groups and funded mini grants in each community to facilitate environmental changes related to food and health. And our work takes place in 3 counties in North Carolina, 2 rural and 1 urban, and this is just a brief snapshot. There's a lot that I could say about these counties. Our study sites are really diverse in terms of race and ethnicity. And the poverty rates for the 2 rural regions is just under 20%, but in the urban region, and we're working in a particular neighborhood in our urban county, is almost double that. So today the focus of my talk is going to be about the ways that the women in this project have talked about how faith intersected with their experiences of food insecurity, and then also the role that religious organizations and institutions might play in thinking about food insecurity based on what these women have told us. So the first thing that I'm going to look at is their experiences with food pantries, particularly faith-based food pantries. I'll also be talking about a survey or some interviews that we conducted with food pantry directors. The second is how they've talked about their bodies, and the ways that they talk about their bodies is kind of informed by their religious sensibilities. And then the final is the ways that concepts like making a way, which is a direct quote, emerged as a valuable counter-narrative to the stories that are often told about poor mothers, poor food insecure mothers, particularly those who are recipients of federal food assistance dollars. Most of our study participants call themselves religious, and over half are marked by their participation in religious services or going to their faith community around twice a week. And they're overwhelmingly Christian. So the first thing that I want to talk about is their experiences with food pantries, and particularly with faith-based food pantries. And for each of these slides, I've put up some quotes from mothers who are a part of the project so that you can see. I won't read all of these quotes, but it gives you an idea of some of what we've heard. So the first thing to say is that food security is defined by the USDA as having enough food for an active and healthy life. Food insecurity, by contrast, is the opposite of that and is characterized by things like disrupted eating, worrying about food, not knowing if you'll have enough food by the end of the month, and skipping meals. And the USDA has a food insecurity scale that you can use if you're trying to understand practices and experiences that relate to food insecurity. So first, many of the women in our study dealt with food insecurity by visiting food pantries, which is something that they felt really conflicted about, as I'll talk about. And most of the food pantries that women attended were run by faith communities. We interviewed pantry directors in each county, and of the 33 food pantries directors that we interviewed, 22 were part of a religious organization. These faith communities were working hard to meet the needs of the communities they served, but they talked with us about not having enough resources to do this work. 96% of the pantry directors reported an increase in services over the last year, and 60% felt that they were falling short of meeting their clients' needs. Many said that they always managed to find something for everyone, but that sometimes they had to give people smaller amounts of food. Many emphasized how their ability to meet people's needs was really variable from week to week. This week, we're meeting the needs, but overall we are falling short, especially with meat, one pantry director told us. Another explained, quote, "We try to stretch it as much as we can, but we do run out. The shutdown," and this is referring to the federal shutdown, which coincided with a change in the ways that that the system for managing SNAP or food stamps in North Carolina was managed, which meant that people had months of delays in getting their food stamps and their WIC payments because of this system that didn't work in North Carolina. So the food pantry director said this made it really bad. We had to have impromptu food drives, end of quote. About 1/3 of the pantry directors said that they had turned people away in the last year because of a lack of food. So pantry directors were overwhelmingly concerned about, quote, ending hunger, but many described their missions in terms of things like, quote, meeting the needs or helping individuals rather than looking at the structural constraints that affected the families they served. So it was really clear to us that the pantry directors cared deeply about their clients, but those constraints faced by the pantries, including their own lack of finances, unpredictable donations, and inadequate storage, which came up time and time again. And that's one of these practical things that we don't often think about, a lack of refrigeration, lack of space, really contributed to an untenable situation. And clients felt, the food pantry clients and the women we spoke with really felt that care, and some talked about the ways that they felt different visiting a food pantry that was run by a faith community because they felt like they were treated as more than just a food pantry client. And many felt, as you can see here by these quotes, really grateful for that support because it was a really important stopgap measure, particularly when we were interviewing mothers who were experiencing that gap in their WIC or their SNAP assistance. However, in addition to feeling grateful, many women experienced mixed emotions having to turn to food pantries. We visited pantries with them, waiting in long lines, and receiving food that many perceived as stale, expired, or, quote, nasty. So we were able to see and hear from them about the feelings of indignity that come with getting cast-offs, seconds, or in some cases what they experienced as expired or almost soiled foods. And some women felt ashamed of having to visit the pantry. So as one grandmother in Harnett County said, "I feel bad I should have to go there to a food pantry, and this is the first time I've ever gone, but my funds. When I got SSI, they cut my food stamps, so now I have a lot less to work with." And this was generally something that was experienced by a lot of the mothers we talked with, was this feeling of not quite ever having enough. And to give you all a little bit of background, like I said, this project is really huge. A lot of the mothers in the project are receiving SNAP benefits, and so they're shopping, they're doing a big shop often once a month. And if you think about shopping once a month and then having to stretch that for the end of the month, those last few days at the end of the month are really difficult. Do I take this back now? Yeah. There you go. Is that good? Okay. So they're really having to stretch those food dollars, and they were doing various things to try to do that, including things like collaborative food sharing. So if your family member maybe has received food stamps at a later part in the month, then maybe you can share food and sort of get by that way, and then also having to rely on food pantries, which they felt were kind of a mixed blessing. So despite these conflicted feelings about food pantries, some of the women in our project talked about the ways that their faith or their religious sensibilities enable them to see God working in and through these experiences of hardship, through their ability to, quote, make a way, a concept that many of you, I would guess, know has really been articulated and finally tuned and developed by womanist theologians. So, for example, one grandmother in Lee County says, quote, "My freezer is always blessed, and I always wonder how in the world I make it good, but God helps me with that because I don't know how that much meat and things come out of that deep freezer, but I feed a lot of people." So while to some this might seem like a kind of fatalism or just, kind of putting things in the hands of God, and sometimes it's represented as such in public health literature when we think about the ways that people's trust in God is talked about in relation to their health. These types of theological framings, I think, might also, or instead, represent the ways that women were really able to make a way or survive despite situations of extreme hardship and in the face of systematic injustice. So they adopted multiple strategies to ensure that their families were fed, some of which directly conflicted with their own well-being. For example, we collected dietary recall data from all of the mothers in the project. So that means we asked them what they ate for a 24-hour period of time, and you do this over 3 days, and then you kind of average that number. So you're trying to get a picture of what a person's daily caloric intake is and also what they're eating and what percentage of each kind of nutrient they're getting in their diet. And we found that on average, these mothers were consuming drastically lower calories than has been reported in other projects related to low-income families in an effort to feed their children. During in-home observations, we saw mothers feeding their children first without eating or eating whatever seconds are left over. And we also listened to how they told us how conflicted and ashamed they felt about going to food pantries, but we stood with them as they collected boxes of food for their children. So they were not sitting idly by, waiting for God to provide food for their families. Instead, they were doing all that they could and can do to survive and make a way. So in addition to carrying out these interviews, we also conducted asset mapping workshops in each of the 3 counties with the assistance and guidance from the Interfaith Health Program here at Emory and John Blevins, who came to one of our asset mapping workshops but couldn't facilitate one of them because he hit a deer on his way. So rural North Carolina, that's what happens. So basically what we wanted to learn from these workshops is what are the particular assets in each community that are related to food, access to healthy foods. And also the project is, we're talking about places to be active, but I'm not talking about that as much in this talk. And the goal of that was to bring together community members and community partners to do some strategic planning around what they saw as the key issues in their community, and also what were the resources that they would use to address those issues. And one of the things that we learned was that in all 3 counties, faith communities were reported as among the most important resources in their communities related to food and access to places to be active. And one of the things that's so brilliant about the asset mapping work that IHP has done in collaboration with lots of other universities and the International Religious Health Assets Program is that it's not only important to understand what a community's assets are, but why they think those are assets. And so participants talked about the ways that faith communities offered spiritual support, as well as those concrete resources like food, shelter, or clothing. Mothers in our study as well talked about the ways that faith communities did not just, quote, just feed their children. They also provided them with activities or with education. 2 mothers talked about how their pastor or another member of their faith community would actually take their children to practices or babysit so that they could have some precious alone time, which is really rare. And then several women actually described their pastors as the healthiest members of their community, serving as role models who strengthened their connections between faith and health. Participants shared remembrances of Sunday suppers growing up, a practice that many continued through their current church meals. And one of the workshop participants in our asset mapping workshop in our urban county related this culture of hospitality to the historical presence of congregations in that Wake County neighborhood, including the vital work that they have done to promote civil rights and social justice. And several of the congregations that we worked at in that community were participants in the state's Moral Monday movement. And so, for example, one of the things that we heard in Wake County was, quote, "This is a little bit more abstract perhaps, but I think when really successful organizations," and we were talking about faith communities here, "operate from a place of love for each other and for the community, and we don't like to talk about love in workspaces, but I think it's really important for there to be that level of love for each other and love for the community." So we heard loud and clear during the asset mapping workshops and also during interviews that the kind of space that was created, or the space that can be created by faith communities in promoting dignity and promoting empowerment, was really felt in some instances and valued by many of the people we were working with. And so finally, I want to talk about the last way that women kind of talked about the connections between faith and food security, is the ways that some women talked about their bodies was really intimately tied to their faith. So, for example, we heard from several women that physical health was really connected to their spiritual health. And there's a vast literature around this in public health, particularly, and in religious studies, obviously, particularly when it comes to issues of being, quote, overweight or feeling like they couldn't control how much they ate. So women felt like if they were right spiritually, or if they were, had their kind of spiritual health in alignment, they would also be able to live healthier lifestyles in other ways, choosing healthier foods or being active with their children. And several talked about fasting as a part of this spiritual discipline. That's something that I want to explore later, because it actually came up in several interviews as fasting being really important to their spiritual health, but also helping them to kind of realign their nutritional health as well. So women also talked about the body as, quote, God's temple, and as such, they told us about how that helped them to think about eating healthier foods, which were usually talked about in terms of balanced meals. So they would talk about a balanced meal as having like a meat and 2 vegetables, for example. And they also talked about this in the context of physical activity as well. So kind of being spiritually healthy helped them to feel like they were more apt to be active and to get out and do things with their children. This one is really fascinating to me. Several women also talked about breastfeeding as being, quote, God's gift, and breast milk as the, quote, perfect God-ordained food. We're working on another paper on breastfeeding. In general, the rates of breastfeeding were really low among the participants in our project, because of lots of big structural issues that and cultural issues that I would be happy to talk about later and I can't go into, but I'm really obsessed with. But for women who did breastfeed, some did so because they felt like it was what God had designed their bodies to do. And finally, a few women talked about how they helped their children and themselves to really counter the images of women that they saw in the media, and to counter that with the image of a woman created by God. So they helped their children to draw on non-physical qualities, and talked about how God decides what's beautiful and not our culture. So this last quote kind of exemplifies that quote. And so we try to temper that, and I say, Jade, what makes you beautiful? And she says, God makes me beautiful. And I say, what is it about you that makes you beautiful? And I'm trying to instill in her that this is not really defining what her beauty is. Her beauty is the kindness and the caring and the gentleness in her spirit. So I think that's particularly important because a lot of the women who are part of this project, all of them, I would say, experience a great deal of surveillance around their children's weight and their own weight. Participation in the WIC program necessitates that your children go in for visits and they're being weighed. And not to say that being weighed at all is bad, but there is this kind of extra eye, and they really feel that as well. Like they feel they're being judged when they visit a health clinic or when they're visiting the WIC clinic. So these kind of narratives of what their bodies look like and who really gets to say what a right or a good body is really countered what they were hearing in doctors' offices. So one of the things that I have found really interesting in reading through these interviews and in thinking about the intersections of food insecurity, food justice, and religion is the ways that for some women, their faith has provided them a counter-narrative to these ways that they're talked about in the broader public. I teach sexuality every summer, and in our class, I have my students read this article called Welfare Queens and Teen Moms, How the Social Construction of Fertile Women Impacts Unintended Pregnancy Prevention Policy in the U.S. And it's by James and Rashid, and it was written in 2013. And the article is about unintended pregnancy, but the author's argument that the ways that we talk about women, particularly poor women and women of color, that they argue that it has an impact on policy and the development of policy. And I think it's extremely relevant for talking about food insecurity and SNAP particularly. So I think a lot of you are probably familiar with things like, legislation that attempts to restrict what people are able to purchase through their SNAP dollars, including things like quote unquote luxury food and junk food. And there's a big debate around this in the hunger advocacy, the hunger community, so people like food pantry directors, and the kind of broader public health community. And it's interesting to me that there's not it seems like it's a big argument, and there doesn't seem to be a lot of common ground, because on the public health side, I feel like a lot of people are really wanting to improve people's access to healthier foods, which is a good thing. But some measures like doing this through restrictions, people feel like that's really stigmatizing and also limiting the kinds of healthy foods that people could buy, because fish for some is considered a luxury item, and according to the USDA, we should all be eating more fish, right? Including things like lobster and shellfish, which are low calorie and anyway. So I think the same thing is true for how people understand what we call food stamps or SNAP. These policies about restricting food stamp recipients being able to buy these candy or luxury items, recipients of federal food assistance dollars are deemed both ignorant for not knowing the right foods to buy, but they're also penalized in some cases for buying those foods, and they feel judged and when they're checking out and might have a food that some people might perceive as a luxury item. And so this kind of rhetoric really impacts how we as a public are thinking about broad policies like the Farm Bill and like SNAP. So what I would say is, as against these images of quote unquote welfare queens, the women we worked with talked about their food stamps as blessings from God, countered the ways that their children were talked about as obese with reminding them that God provides them with an alternate identity, And they made concrete suggestions about the ways that faith communities could do a better job in supporting them. Some suggested providing childcare so they could have a break, and as seeing them as more as just a receptacle for food, as a whole person. And then thinking about the kinds of food that are offered at food pantries. Are we giving just people our seconds and they feel that and they experience it? And then finally providing opportunities for their families to really be together. So women, particularly poor women, are the targets of much of this research around nutrition and food insecurity, and our broader public health practice in these areas, particularly related to those healthy foods and food access. And mothers are also experiencing, they are perceived to bear that burden, and we kind of put that burden of responsibility on them of feeding their families. And we often judge them harshly for the ways that they do it. And this is not only low-income women. If we think about the breastfeeding wars, I'm sure lots of you can go on Facebook right now and find people arguing about breastfeeding that erupt in how we judge maternal practices. So the women that we have worked with are really doing the best that they can with very little resources. And I would say that their words provide counter-narratives that talk back to some of these ways that low-income women are discussed in the media and in public health discourse, even when that discourse is well-meaning and attempting to promote health. In other words, their faith narratives of, quote, making a way, speak back to certain maybe underlying or unspoken assumptions of women who don't know anything, who might be lazy, or who just need one more nutrition class to help them understand how to feed their children. Instead, by drawing on religious frameworks, they're able to carve out an alternate identity, one of chosenness, one of blessing, and one of perseverance. And these counter-narratives, I believe, have to be a part of our conversations about food access and food insecurity. So I want to take just a few minutes to talk about some of the community work that's happened out of this particular project. So we've offered mini grants to organizations in each of the counties, and organizations has been really loosely defined. In some cases, it's been a person who's doing really great work in collaboration with an organization for food access projects and physical activity projects that relate to what we're hearing from the participants in our project. We made the application really simple so that organizations that were new or who had never received a grant before could apply. And in this way, we were aiming to counter that tendency to fund only organizations with high organizational capacity or long track records of existing research, since this can reproduce inequalities. We provided potential applicants with an overview of the major themes that we were hearing from the research we had done, and we prioritized projects that had addressed these topics. And actually, all three of the projects represented here, we had heard from multiple participants in the interviews about how these three organizations, the great work that they were doing, how they appreciated being able to take their kids to the walking trail at one church, to the parent and child activities at a Neighbor to Neighbor is actually a faith-based organization. And then there are $1 Zumba classes at First Baptist Church in a major city in one of our counties. And so in general, while we aimed to engage in outreach or in praxis activities that subverted existing power relations and reflected what we were learning from our research participants, we were also hemmed in, obviously. We were a federally funded grant. So we had different funding restrictions and organizational requirements. And these are some examples of some of those organizations who were directly cited by the mothers in our project for the work that we were doing and who we were able to fund. So the one on the left is a skate park in an urban neighborhood. The one at the bottom is a church community garden that donates to their food pantry. And then the top right is the Zumba classes, which we actually attended and heard about a lot from participants, because they offer $1 Zumba classes, and they also open up the faith community's facilities for physical activity, so kids can come in and use the gym, and it's one of the only free or very, very low cost opportunities for families to be active in that community. So finally, I just want to think about I want us to consider what is and what could be the role of faith communities in this kind of food security work. So first, I think it's important to point out the good work that's already being done. The pantry directors that we spoke with, as I said, are really concerned about the people they're working with. However, they're facing these giant barriers, including their own funding, lack of foods, lack of resources, and lack of space. So what are some other ways that we might think about the intersections of faith communities advocating for or participating in this kind of food justice work? So first, I think it's important to point out that food pantries, even though sometimes they're talked about as such at a policy level, are not an adequate substitute for federal food assistance. So I think that sometimes in a faith community setting, particularly a lot of the faith communities we've worked with have jumped to start a pantry as the kind of solution to hunger or food insecurity in their community. And that's not a bad solution, but if that's the solution without thinking about the broader structural issues or cuts and SNAP that are actually leading people to the pantry, we're just going to continue to have, people not having enough food in the pantries. So first, thinking about the broader kind of food security policy. And then second, helping faith communities to think about food as a fundamental human right. We might help them to think about food distribution models that are really looking at more social, rather than food as a social responsibility rather than food as an individual responsibility. Because while pantries are excellent stopgap measures, they are really individually focused. And focusing at that individual level kind of masks those underlying social problems that are beyond the reach of individuals to control. So a lot of scholars in this kind of food justice research are turning to a more rights-based approach, which frames good nutrition not as something that should be doled out based on benevolence or charity, but rather as a duty or an obligation of a country to its people. And so sometimes I think these ways that we have of promoting charities like food pantries can put the broader issues and social inequalities, kind of put them off the hook a little bit, because we're fixing the problem, we're partnering with faith communities, we're getting people access to foods. So really thinking about the social responsibility as food. And then finally, third, in the meantime, we can think about some concrete solutions about making food pantries a more stable, sustainable, appropriate source of food for people who need it. So we've been working a lot with food pantries to help them consider choice-based programs. So instead of people getting a box, receiving a box, actually setting up the pantry more like a grocery store so that people feel more dignity. They're able to pick out the foods that their family likes and the foods that their children will eat. And then also we've been working with local farmers and other sources to help get healthier foods into food pantry settings. So these are kind of concrete short-term solutions as we help faith communities to really think about addressing those broader social issues. Faith communities are already active in much of this work, and Jennifer Ayers' excellent book, Good Food, is proof of that. But what we need now is to add this lens of the voices of those who are affected by these policies, by these cuts, and by these emergency stopgap measures. What do they see as the solutions? How would they encourage their legislators, their faith community leaders to address them? And how can we support them in doing that work? And this is exactly what we're asking mothers in the last year of our research, which is starting in just a couple of weeks. And I would love to come back in a few years to tell you all about what they said and how that final year went. So with that, I'll open up for questions, but I'll just say thank you. And this is my contact information.